Hi guys, it's Med by Health Hush. In today's topic, I'll be discussing about normal labor. How do we diagnose normal labor and what are the stages involved in labor? So, labor is usually diagnosed clinically and we do not require to do any sorts of investigations. And it involves three main stages, which I'll be discussing briefly in my future slides. So let's see what are the symptoms and signs that are involved in normal labor. Symptoms include colicky type lower abdominal pain, and if I describe what colicky type means, it means that this pain is localized and it comes and it disappears and again it comes back, and this is like an episodic type pain. This pain also increases in frequency, intensity, and duration with time, and it is not relieved by any sorts of analgesics. These symptoms are present in most of the pregnant mothers, but it can be absent as well. Let's move on to the signs that are present in pregnant mothers who are about to deliver their babies and they have painful uterine contractions. So usually during pregnancy, mothers have uterine contractions, which are normal uterine contractions, but these are painless, and they are known as Braxton Hicks contractions, which occurs during pregnancy. So, but during delivery, the mothers will start to have painful uterine contractions, and it's a sign. So they also have progressive effacement, and effacement means that the cervix is short and thin and it becoming short and thin, and also the cervix starts to dilate. So let's see what is our anatomy in our pregnant mother. So here you can see the uterus, and here you can see the amniotic fluid with the sac and fetus in it, and umbilical cord, placenta, and here you can see at the end there's the cervix, and during effacement progressively the cervix will become short and thin and this opening will dilate and the baby is then delivered. So here you can see a little bit more close up of the cervix, and you can find the internal os, cervical canal, external os, and the fornixes, as well as here you can find the exocervix. So let's move on to the stages of labor. So as I said in my very first slide that labor involves three stages: first stage, second, and third. So first stage has latent phase, active phase, and second stage involves passive and active phase. And let's see what first stage looks like. So first stage basically means that the cervix is dilating from 0 to its maximum dilation, and here you can find the latent phase. So on the latent phase it says that the cervix is dilating from 0 to 4 centimeters, and this is really a slow phase and it takes up to 6 to 8 hours to complete. And once the cervix reach a dilation of 4 centimeters, then suddenly starts the active phase. And active phase is starting when the cervix has dilated 4 centimeters, and then it starts to dilate to its maximum dilation at a rate of 1 centimeter per hour. And if I say what's the maximum dilation that a cervix could have, in average is about 10 centimeters. So let's move on to our second stage. Second stage starts at the end of maximum dilation of the cervix until the baby is delivered. So let's see what our passive phase means, and it is also known as descent phase. So before the second stage starts, usually the head of the fetus is fully engaged, and if we see what does this fully engaging of head means, here you can see a diagram. In this diagram you can find the fetal head. Here you can find the pelvis and the pelvic brim. You can find here, and this is your pelvic brim line. So once the fetal head, the widest part of the fetus head, descends below the pelvic brim, then we say that the fetal head is fully engaged. So in this pregnant mother, if we do abdominal examination, we can see that we cannot find any position for fetus head. We cannot palpate the fetal head, which means that it's a sign of engagement. So let's come back to our passive phase, and it says that once the engagement is fully done, then proceeds with the descent phase. Descent phase means that the fetal head is descending down to the pelvic floor, and during this period we do not encourage mother to bear down the baby. So let's move on to active phase. In active phase, which means that once the fetal head has reached the pelvic floor, suddenly the mother starts to feel an urge to bear down. During this time, we encourage mother to bear down along with uterine contractions. So let's move on to our third stage. Third stage basically lasts about 30 minutes, and this is mainly starts from the delivery of the baby to the delivery of the placenta and membranes. So guys, this is a brief description about the 3 stages of labor and how to be diagnosed, and I'll see you guys in my next video.